Guys, welcome to the Parents Anonymous podcast. I'm Tal.
I'm Rupali, and as a disclaimer, all of the experiences and the opinions that we share are our own.
All right, well, welcome to today's episode. Today's episode is going to be on the pregnancy itself. So we're going to talk about that. But there's another element that will be in another episode. You want to mention that?
Yeah, I think with the pregnancy itself, I'll obviously share my experiences with both of our children that we shared in our first episode with you guys. Our daughter is 3 and our son is 11 months old, and we'll share the similarities and differences in each of the pregnancies. And another element of being pregnant is being healthy. And what does that mean? What does that look like? When you go to the doctors, you get your weigh in, you measure your belly, and as you go along, you do certain tests, you do blood work, et cetera, et cetera. But what does that mean when you go home? What do you eat? How do you exercise? How much do you exercise? All of that. But we'll cover that in a different episode.
Yeah.
Yeah.
So, why are you here? What do we bring? This episode itself is meant for anyone that's pregnant, anyone that's supporting someone that's pregnant, or you might just have a family member or friend that's pregnant and you just want to have that knowledge of how you can support them or what it looks like. So the way our episodes are set up, you can listen to any one in any order you like, and hopefully it's informative for you. So again, a lot of our experiences are our own that we'll share, and if you have some that you would like to share, please, you can reach us at Parent Anonymous Podcast on Instagram, also on Gmail at parentsanonymouspodcast@gmail.com. And we would love to, yeah, hear your experiences as well, or any feedback that you have for Rapali and I.
Yeah.
So let's start it off. You're pregnant. What's going on?
Yeah. And pregnancy is really split into 3 trimesters: the first trimester, the second trimester, and the third trimester. So the first 3 months, and then the 3 to 6 month point, and the 6 to 9 months, right up until the birth. And each trimester is different, and each trimester is unique because your body, if it's your first time, especially, your body's never done this before. So what comes along with it, you don't really know until you're actually pregnant, right? You hear from different people about different things that happen in the first, second, and third trimester, and it may or may not relate to you. So why don't we start with the first trimester? I think with the first trimester, overall, for my experiences for both pregnancies, I think pretty good.
Yeah.
I had very little nausea. That's one of the main symptoms that we hear of, is hard to keep food down. There's certain smells that can be very triggering to your
Yeah,
nausea.
good word.
And there's other people who just never get nauseous. They just have fatigue, a lot of sleepiness. And usually those are the main things. Like there's not very much when it comes to the first trimester that happens. Sometimes what can happen in some women is having some bleeding in the first month or so. And that can be actually really scary and really nerve-wracking because you're not sure why you're sometimes bleeding. And it's actually the um,
Plantation bleeding.
implantation bleeding. And I think that's something that people don't realize sometimes. And I know that that can be really scary, especially if you're a first time parent. And, sometimes as women, there's a lot of pressure that you're taking care of yourself, you're staying hydrated and all of that. But yeah, really the first trimester, I don't think there's much change per se. I remember when I was pregnant with our daughter, we were driving on a trip somewhere, and I remember being so absolutely nauseous that whole, road trip. And I don't think I ended up vomiting in the end, but I was definitely nauseous that whole road trip. Do you remember that?
I do remember that, and as the driver, I'm worried, and I want to make sure you're okay, and having the window open at times, and just trying to manage those symptoms.
Yeah, the worst nausea I ever had, I think,
Yeah.
was then. Yeah. And then I think with our son when I was pregnant, there wasn't, to be honest, I don't think there was much in the first trimester.
No.
Like I was good.
Yeah.
Yeah.
No, I think it came much later, which we'll talk about.
Yeah.
But the big thing for those of you that didn't catch our first episode, so we have 2 children. we have a 3-year-old daughter. She's our toddler, and we have an 11-month-old son as well. So that's the experience that we bring,
Mm.
parents to these two beautiful children, and they are quite interesting. They're very different, and the pregnancies were very different. So that's where Rapali is gonna, share that bit. And what I bring to the table is a partner. A second time around, I was already a father. First time around, I wasn't a father yet. I was just, a supporting husband. So if you're listening, like just because you're becoming a dad doesn't mean you don't play a vital role in the pregnancy as well. Yes, Rapali, did the hard work, carried the child in her womb, but that's where we're gonna talk about that. I was worried of my wife who's having this bleeding, and you start thinking worst case. You've seen it in movies, or you might have heard of, the term miscarriage, right? And we're
Yeah.
going to talk about that in another, episode
Yeah.
of that being a taboo topic. But miscarriages are actually very
Very
common.
common. Yes.
So during that bleeding, you start to go to a dark place, a
Yeah.
very bad place. And for Rapali's first pregnancy was during COVID, so there's that added element where I couldn't even go in with her to the emergency room to even get it checked out.
Yeah.
But for those that don't know what implantation bleeding is, just to give you a quick background on it, so you have the uterus where the baby's going to grow, and when the embryo is attaching to the uterus, there is bleeding happening due to the embryo implanting into the uterine wall.
Yeah.
So that's where that bleeding comes from. So that's why it's there. It's completely normal.
Yeah.
And you may or may not experience it as a new mom. So
Yeah.
yeah,
Yeah. Yeah. And I think you're right. Having it being COVID times and you not being able to come in, I know that was really scary
yeah,
because all the focus is on the mom. All the focus is on making sure that the baby's safe and there's a heartbeat and all of these things, right? And I think as a partner, you have a huge role to play in that. And I think, in our experience, we both had each other, but I think of parents who are single parents and how they did that on
yeah,
their own, especially being pregnant, right? Like right in the beginning. And now I guess moving on to the second trimester, they call this the honeymoon trimester because there really isn't much in terms of symptoms that goes on in the second trimester. Usually your fatigue is a little bit better, so you have a little bit more energy in the second trimester. And really, the main thing that you need to pay attention to is your weight gain because you are going to gain, on average, 25 to 35 pounds. That is the average, right? There's people who gain less than that, and there's people who gain more than that. But the average is meant to be 25 to 35 pounds. And your second trimester is really actually where it skyrockets quite a bit. And sometimes people think it's actually the third trimester, which is not true. The second trimester, it skyrockets. And then near the end of the third trimester, things kind of just level out near the end and plateau exactly. So I think with the second trimester, there really wasn't much changes. There's obviously a couple of ultrasounds that you do, there's blood work, there's different kinds of testing and swabs that you do as well.
yeah. There's great resources available that you can follow along if you're unsure. Obviously, our podcast hopefully can help provide some of that information, but there's a great site called What to Expect.
Yeah,
Um,
app. Yeah.
there's an app as well, and there's blogs on there. And I believe her name is Heidi.
Yeah.
She's the one that created it
Yeah.
when she was a new mom, and now she's a grandmother. She's also has a few books out there. Um,
Yeah.
she's not sponsoring the podcast, but we just a great resource we want to share. And then if you're in an area where you have a local health unit, they're a great resource as
Yeah, public
well.
health unit.
Yeah, public health
Absolutely.
unit.
Yeah, and I think for both of our pregnancies, we had the What to Expect app, and it's exciting because you put in there, every so often that updates. Oh, the baby is the size of a cantaloupe. Like obviously that's near
Yeah,
the end, but like it has different fruits, like a kiwi and like an orange and all of these things, and it really not only isn't helpful to look at for, oh, this is the size of the baby, but the kind of symptoms that you have and the kind of things that you might be experiencing, and also the kind of tests that might be coming up for you.
yeah.
So yeah, both of our kids, we definitely had the what to expect app, and we kind of went along with
Yeah.
it each week and each month in the pregnancy, and we found that really helpful.
And just as a disclaimer, if you do live in Canada, like us, the site or the app itself may have a lot of American
Yeah,
information as well.
true.
So some of the tests may be named different or done at different intervals. So just keep that in mind. You can always cross-reference with your public health unit
Hmm.
or your doctor as well. So for probably for our viewers, do you mind just talking about the process about seeing your doctor, what that looks like.
Yeah.
Um, yeah.
Yeah, and again, it's different for everyone, right?
Mhm.
Because depending on where you're living, it's whether it's your family doctor or you go to a specialized clinic, it's totally different, right? So I think so for us in both pregnancies, we were referred to a group of maternity physicians that have an outpatient office who are also the same physicians that work in the local hospital that actually deliver the babies and work there as well. So yeah, for us, we did have that, which was actually really helpful because the clinic itself is for pregnant mothers,
Mhm.
and they see the baby after the baby's born. They see the baby to up until 6 weeks,
I believe so. Yeah.
and then they kind of discharge you to the family doctor. That's not always the case for everyone, though. So it depends on where you are living, and it depends on, what the procedures are there for
Yes.
which physician you see. But yeah, the goal really of that clinic is to ensure that you're gaining weight, to make sure all your blood work it looks appropriate. If there's something that's off, referring you to a more specialized clinic or physician is also something that they do. So for us in our first pregnancy with our daughter, we actually did have a complication come up, and I think it was discovered near the end of our first trimester, just
Yes.
the beginning of our the second trimester, where in one of the ultrasounds it showed that our daughter was not gaining as much weight as she should be, and it was resulted that this might be. It didn't say for sure the initial ultrasound, and it said this may be a velamentous cord insertion.
Yeah. So just give you a little background. When they look at the weight or they're tracking the weight of the child, it's done via ultrasound.
Hmm.
It's not very precise
Yeah,
per se. They give you a rough estimate of plus or minus a pound essentially. So
yeah,
it's quite a range. What when we discovered that there was a potential for a velamentous cord insertion and what that meant to us, we didn't know what it was. So again, the type of parents that we are, we're right into action and we started looking into it. Rapali does have a background in the medical field,
hmm,
but you know, I don't. I don't, but I like to look up the information and utilize what's out there. So just to give you guys a quick synopsis on velamentous cord insertion, is you have a placenta and the cord itself, and that's the umbilical cord that comes from the baby, goes into the placenta, but it's supposed to insert into placenta at the medius part. So the velamentous cord insertion, part of the cord is kind of left exposed. So there's a potential for loss of nutrients
yeah,
and blood flow to that baby.
yeah.
So what happened from when we found out the
Yeah, we'll
velamentous?
share as we kind of go through the trimesters what happened at the end. Of course, we're um, glad and grateful that our baby was okay and she came out fine at the end of the day, which is really we're thankful for and we're grateful for. But there was definitely scare points because it is one of those complications that's actually quite serious.
Hmm.
And there could be a chance that if the baby's not growing and the baby doesn't continue to grow, that you deliver the baby early,
Yeah.
right? And we know what that means, that when babies are born early, they sometimes have to spend time in the NICU on, respirators and tube feeds and stuff like that. So that's something that was definitely a scare for us in the back of our mind. And we were referred to a specialized clinic
Yeah.
where the physician themselves did the ultrasound for our
Yes.
daughter and would give us updates right on the spot as we went on.
Yeah. Yeah. Just So you know the differences when you have a typical ultrasound done. It's done by a lab tech or an ultrasound tech.
Yeah.
It can be done at your local hospital or a private company where
Yeah.
you can go in and get a requisition from your doctor. Whereas the specialist, yeah, they're doctors that got that extra training and they do that scan themselves. So
Mhm.
they were able to kind of walk us through it live and we were both able to go together,
Yeah.
which was great for because you were still working during that time.
Yeah, absolutely. I was working, right up until the last day, the day that she was born,
Yeah,
actually, which again, we'll talk about later. But yeah, I was working during that time because my weight was progressing as we were hoping it would, and the heartbeat and all those things were normal.
yeah,
So we were just told to keep going to the physician, the specialist, as well as the maternity clinic, and
to monitor.
to monitor.
Yeah.
Yeah, and I don't think we were told whether the developmental cord was actually true or not, right?
Yeah,
Yeah.
there wasn't
It was a
100% certainty that
Yeah,
it
it was like a
was.
suspicion. It wasn't a
Yeah,
confirmed thing that
yeah.
that was there.
And we'll again, it won't be in today's episode, but looking back, the probability I would say is pretty high that it was.
Hmm.
Just the size of her daughter,
Yeah,
weight wise when she was born.
yeah, yeah. And I guess we should transition now to the third trimester.
Yeah.
Okay.
Before you do though, I just want to
Yeah, yeah,
mention like during this time, so you're probably thinking, hey, I'm the dad or I'm the partner. Uh, of this, future child that is coming, so I'm gonna be the father. What can I do to support my partner, right, in this pregnancy? The big thing is just being confident. If you're someone that likes to find out information, by all means, look it up. For tracking wise, I really recommend just that What to Expect app.
yeah,
Follow along. There's not really anything else that you need to do at this point in time, and especially in the first 2 trimesters. Don't overwhelm yourself with all the information.
yeah. Take it as it comes.
Yeah,
And I think another thing to note is something that I'll say when it comes to how you were showing up, up to the first and second trimester, as we've talked about, is you were at every single doctor's appointment, whether it was a specialist, whether it was a maternity clinic, and I think you made it to most of the ultrasounds as well.
yes,
And um, that's really important because then you hear the same information, and especially if there's something wrong or there's a potential of something to go wrong, having that presence itself is so important, right? Of course, with that, you provide the support and
yeah,
reassurance as you need to, but I've seen it that that's not the case, right? I
mhm,
think that beginning bit when someone is pregnant and their partner is showing up for them to a physician's visit, that just shows your commitment right there.
yeah,
And that's just the beginning, you know?
yeah.
That's not the child's not even here yet. So,
I was very fortunate work-wise that I was able to.
yeah.
Not everyone's gonna have that ability, but we live in the era of technology.
Yeah.
So if you do have to work you can't make it or your job requires you to be kind of far away, and that's totally understandable. This worked out for us, but by all means, use video calling, be there
Yeah.
during the appointment. I'm sure
Yeah.
most doctors or midwives or nurses wouldn't mind that you're there
Put it on
virtually,
speaker.
put it on
Yeah.
speaker, right? So
Yeah.
by all means, please support your partner during those times because she's going through it. It can be scary, especially if you're a first time mom, or maybe unfortunately there was some miscarriages before,
Hmm.
stuff like that. So pregnancy can be scary. I think it is scary, just to be blunt about it. But knowledge is power, and you'll hear us say that a lot. That knowledge is power. When there's
Yeah.
something that you don't know, like look it up, and we're hopefully through our podcast be able to direct you in the right way to find that information so that you can again we're true tried and when it comes to both our children and
Yeah.
there's a lot that we've learned
Yeah.
yeah
Yeah. And ask questions,
ask
right? Ask
questions
questions to the physicians who are the experts and
yeah
the nurses and the medical staff.
yeah
And on to the third
yeah
trimester
the third
now.
trimester we're almost there
The third trimester is really the final push. I think there's a lot of symptoms that come up in this trimester. Unfortunately, this is not the trimester where you are it's not a honeymoon trimester anymore.
No.
You are now really in the home stretch. So things that come along with this trimester is heartburn, backache, and pain because a lot of your weight is now shifting and your sense of balance is shifting because you have a child that you're carrying in the front of your body, and it really puts a lot of pressure on the back.
Yeah.
And sometimes there is a lot of heartburn, and also there's a period and bouts of energy that you get near the end of the third trimester, and that's called nesting. So really that instinct as a mom is really starting to show up now near the end of the third trimester where you feel like I need to get things ready, whether it's the nursery, whether it's your hospital bag, all of these things that you feel like, just to get prepared for the baby. And of course, the birth itself, right?
Yeah.
So your mind is thinking about when is this going to happen? How is this going to happen? So sometimes there's stress involved in that. And it's really important, again, to, if you're feeling a certain way, connect, converse with other people. It's really important. And uh, having a supportive partner, again, to talk to about these things as they go on is really important. Having things like massages, using the resources that you are able to use is really helpful. So with our daughter, I was pretty good near the end. I think there was the last probably week or two right before she was born. I was in a lot of pain, and again, I was looking at anything and everything to help with my back pain.
Yeah.
I was still working all the way up until the end
Yeah.
because I was able to manage the pain and I was still able to move around and I wanted to
Yeah.
stay active. And I did go to things like massage therapy, which when you're pregnant, you can still get massage therapy. You just have to adjust your positioning a little
Yeah.
bit, but it's actually really helpful. And I also did some acupuncture, which wasn't so helpful, but I think it's probably practitioner dependent as well.
Yeah.
But I was trying to get any help that's possible. I used a Velcro belt, which helped kind of keep things lifted for my belly so that I'm not really hunched forward with the weight.
Yeah.
And then with our son, I used massage therapy again the second time go around, but I did use a chiropractor quite
So yeah,
regularly near the
that's
end.
specialized in
Yes,
pregnancy.
yes, that's
Yeah.
specialized in pregnant women,
Yeah.
helping with their chiropractor. So that was extremely helpful. I
Yeah.
have to say the third time around, or the second time
Yeah. Second time around.
for the third
Yeah.
trimester. And yeah, so in terms of our daughter, that pregnancy in the third trimester, I think overall it was okay.
Yeah.
The only thing we were not expecting is she was earlier than we thought. She was 2.5 weeks
Two and a
early.
half. Yes. So for those folks that don't know, they consider a full term 37 weeks, right?
Yeah.
For 37-week period, then your baby is technically fully cooked.
Yeah.
But you'll hear the 40-week mark
Yeah. So
also
between
mentioned.
37 to 40, you are
Yeah.
considered full
Yeah.
term. So really, it's any
Yeah.
day after that.
And just so you all know, like babies can be born at any time. You'll have premature births that can
Yes.
happen months, and we know someone that has
Yeah.
had that, or a few people,
Yeah.
and it doesn't mean it's worst case scenario. Like it's not ideal, but
Yeah.
children are very resilient
Yes.
and for the most part survive and do well in their life. Um, we'll talk about it in another episode, and Rapali's a great example of this. Is like a pregnant person's fitness level, what they should eat, things to avoid, and what they should do physically to really optimize the birthing process and that last trimester and having a child being born within that 37-40 week mark.
Absolutely.
We do know of at least two moms that their children were born after 40 weeks,
Hmm.
and what typically happens with that is the mom is just done and she's exhausted and she just
Hmm.
wants the baby out, right?
Hmm.
So hopefully the next episode that we talk about, you know, fit, you know, fitness and pregnancy will hopefully help others optimize that as well.
Yeah.
From a partner's perspective, what can you be doing during that third trimester? Big thing is supporting the nesting, right? If
Hmm.
your partner is wanting, as an example, like organizational boxes of, I want to organize the baby's clothes, a newborn, assist with that. Get on Amazon, purchase those things. Uh,
Building furniture.
Building furniture, right? Like we did a lot of IKEA furniture
Yep.
that we still use to this day. So
Yeah.
like that was my expertise. I
Yep.
got in there with my drill. And the other thing is the to go bag or the hospital bag they call it.
Yeah.
Um, Again, what to expect has a great list on there, or if you just search hospital bag for
Yeah.
delivery, there's a lot of things that from the first time to our second child we learned that I would
Hmm.
rather have at the hospital with
Yeah.
us. uh, you don't know how many days or hours you're going to be there,
Yeah.
so be prepared, especially if you live far away.
Yeah. Really, when you're the beginning of your third trimester, at least that's what we did. We had a hospital bag ready
Mhm.
because we just didn't know when it would happen. And even in terms of when our daughter was born, she was early, and I think it was it was actually my last day of work, so I was very close to the end, but she was just at the 37-week
Yes.
mark that she was born. And I remember hearing from so many parents and people that, oh, babies, especially if it's your first time, they're rarely born the first time around, like, or born on time or early. They were always like, oh, they'll be late,
Yeah.
it'll be after your due date. So I don't know why in my mind I was kind of expecting that.
Yeah.
And she was all of a sudden she was just early.
Yeah.
So really, we had all the things ready. We had the nursery ready. We had the hospital bags ready. We were okay.
Yeah.
We did stay 2 nights in the hospital. And, with our son, we stayed one night. And we should talk about that as well. So with our son, I believe it was in the beginning of the third trimester or near the
Maybe the end of the second trimester.
end of the second
Yeah.
trimester. There was one ultrasound that was done, and it showed that our son was breech. And with the very first ultrasound that happened, because it was the end of the second trimester, one of the ultrasounds showed that he was breech, which means that his head was up. And with the first ultrasound, it wasn't much of a concern because the doctor said that, oh, it's still early. The baby can still turn.
Yeah.
And then when we did the next ultrasound after that, he was still breech. So his head was still up. And there was another ultrasound after that, and he was still breech. And I remember that we were at a point that we were told this baby will not be delivered naturally, and we need to schedule you for a C-section. And our daughter was not a C-section. She was a natural birth.
Yeah.
And with that came a lot of stress, a lot of emotions, and a lot of anxiety because a C-section is not something that I was wanting. With our daughter, she was natural birth. There was no epidural, none of that. And she's a healthy, thriving,
Yeah.
toddler now. And I was wanting the same for many reasons. Surgery is not easy on the body. There is a lot of medications, strong medications that go through your body. And if you're breastfeeding, that's something that you think about, as well as when it comes to your recovery after C-section. It's very hard.
Yeah.
And as you've mentioned before, I work, in the medical field, so I have some understanding of what a C-section would entail.
Yeah.
And after that, when we were told that you will be scheduled for a C-section, we both kind of were stunned, I think, and we didn't know what any of that meant. And we looked at, well, is there any option that this child can be born naturally? And we looked at multiple different options. We looked at a very large, center that specializes in, um, complexities when it comes to pregnancies and births, if it was possible for that to happen there. And really, we were not getting any answers. We looked at so many different options. I think we called multiple midwives, their offices, to
Yeah.
see if this was possible. I remember you looking up so many different things. We also, through my chiropractor, there was a couple of resources that she shared of some ways that you could turn the baby.
Yeah.
You want to speak about those?
Yeah, so
Yeah.
I just want to kind of mention a little bit of, I feel like I'm the background guy. I like to bring that kind of
Yeah.
knowledge being the outsider. Again, I'm not in the scientific field or medical field, but I do love science. That's just how
Yeah.
I've been ever since I was a kid. Just to give you a background, so natural birth is a birth that is when a baby is delivered vaginally. So they, there's contractions, and then the mother essentially pushes that baby out of the body. The head is supposed to be down. They consider that a normal
Yeah.
um, birth. So head down. That's the first thing that comes out. First thing you see, and then the rest of the body follows through. What a breech is with the head is up. Now, during that second trimester, third trimester, baby can turn many different times.
Anytime. Yeah.
Anytime you could take an ultrasound and the head is down, and it could be literally a few hours later, the baby could
Yeah.
be
The same day.
somersaulting.
Yeah.
Yeah, same day. So we were told that our son was a breech, not only a breech, frank breech. Uh, frank breech is essentially its legs and upper, like the torso, are kind of in a V shape and they're sandwiched together. So like his toes would probably touching his forehead
Yeah.
kind of thing.
Yeah.
Um, they don't typically deliver naturally or vaginally for those births because there's a higher chance of complications.
Yeah.
And just we're limited to resources in the area that we live for operation like OR rooms.
Yeah. Yeah. And I think we also, with that, the risk is that the head will get stuck,
Yes.
right? Because typically with a natural birth where the head is down, that is usually the largest part, right? And once that's out, it's a lot easier to, deliver
Yeah.
and push the rest of the body out. And with a breach, it is really
Yeah.
complicated, And you're right. So if this is something that we were going to risk, the OR needs to be available
Yeah.
because in case there is a complication.
Exactly. So
Yeah.
the doctors that are available to us, they don't typically deliver. I called and was trying to say, hey, is there any doctor there that would, deliver our child breech? They said you can't kind of pre-plan it, and
No, it's really your luck if the doctor is working when your water breaks
yeah,
or etc., then that's kind of it,
yes.
right? So
Now I can't really speak to this, but at the end of the day, the mom, right? She has an idea of how she wants to give birth. And that's an individual decision for every single future mom or mom out there. um Rupali did mention our first birth with our daughter was natural birth, so
mhm.
that's something that you knew. And again, we won't talk about the birth in this episode. That's a
No,
whole another
yeah,
topic on their own,
yeah,
with a natural birth and the breech or a c-section. But what I would say is, yeah, it is a major surgery. They're cutting through 7 layers of tissue
yeah,
to open up to extract that child, right? So that's why that was, you mentioned to me that was going through your mind. So
yeah,
as a husband, as a partner, I was trying to support your feelings,
yeah,
what you wanted for birth, and doing what I could do, and that was to kind of call. I called a few midwives. Again, when you're not being followed by those particular midwives, they have their own allotment of patients,
yes,
and they're unfortunately stretched out resource wise.
yeah,
We are already with the doctor and they don't do it. So we were kind of in a situation where it wasn't in our control.
yeah, and it was really stressful. And even when you say 7 layers of skin and you say extract, like it sounds so unnatural, and it's just not something that I wanted
Yeah.
at the end of the day. And I think with the just going back to the third trimester, there was different sites that showed, oh, this is how you can turn the baby at home. So I remember being literally, as you set up for me, like basically a table, right? That
Yeah.
my head is down and I have to stay in this position with my head down and my legs like up in the air to see if that baby will turn.
Yeah.
It was a very stressful time.
It was.
It was a very
So
stressful
I
time for
essentially
me.
took an IKEA table, our daughter's little table that she would color on, flip it upside down, and then help Rupali get head down and on an angle off of our couch. An idea was it pushes the baby down, allowing the baby to
Have more
have
space
space
to
to kind
turn.
of turn and somersault.
Yeah, but
Um,
he didn't. He
he
didn't.
didn't.
There was a few times that I remember my my stomach looking just absolutely totally deformed because I think there was times that he was on his side or something, but there was at no point that he had
Yeah.
fully turned.
And there's no way of knowing if you,
No.
like most of us, don't own an ultrasound machine at home.
Yeah.
You just don't know. You could try to feel for it, but you might be feeling the bum or the head.
Yeah.
So that method was called inversion. For those of you
Yeah.
that are like me, want to know what it's called,
Yeah.
inversion.
Yeah. We created our own inversion table.
Yes.
And I remember there being a point where I shared, how I was feeling about the whole situation because I was very emotional. I was very stressed out because people around me and my family, they knew I did not want a
Yeah.
C-section. And when I did get emotional at a certain point, with one of my family members, I was told that I should not cry and that everything's going to be okay. Again, it's that element of, being in a brown family where you're
Yeah.
told that your emotions and all of your, negative feelings or your stress, you just need to put it aside and
Bottle it up
just
and
bottle
suck.
it up
Yeah.
and just think positively. Like
Yeah.
it's going to be okay,
Yeah.
really. But I didn't need that in that moment. What I needed was just someone to listen to and just someone to just be around.
Hmm.
And yeah.
Yeah, and it doesn't mean that, hey, you can't be positive and yet still feel your feelings, right? I can't,
Hmm.
if I'm sad, I'm sad, right? Or
Yes.
if I'm angry, I'm angry. Like I can't, why bottle that up? Why push
Yeah.
that down? And that's not healthy. And we're not psychologists by any means, but I'm sure the literature out there would say it's you're supposed to talk about it.
Yeah.
Don't internalize it.
Yeah.
So that's where, as if you're one of us, like, you're brown or you're South Asian or you're come from a different culture than the Western culture, you're told to, hey, we don't talk about that. Be
Yeah.
happy.
Yeah.
You know,
Yeah.
you're pregnant. You're not like it's
Yes.
you're and C-sections are actually very common around the world. It's the
Hmm.
typically prescribed method.
Hmm.
And that's something that we might not be able to, I think, cover in today's episode. But
Yeah.
trying to, how can we, advocate for natural birth or moms wanting to do it naturally, right?
Yeah. And I think as we wrap it up, we something we did do in this case because we kept getting pushed to select a OR date, and I kept saying no.
Yeah,
That I want, if I don't get to decide the way that my baby's coming into this world, I
yeah,
at least want to decide, or at least want my body to naturally decide the day of the birth
yeah,
that this baby will have. So I remember that I said to the doctor at that point that actually I don't want to select a date until it's at the 40-week mark, which is really pushing it,
yeah.
but that is what I said. I said at the 40-week mark, if the baby's not here, then I will schedule a C-section.
Yeah, and that's what Rapali meant, if, for those viewers that were wondering. Like they tell you like, hey, we'll actually set a date, and the baby's gonna be. They're
Yeah.
literally setting the birth date of the child.
Yeah.
And because it's an operational room, right? Operations room. So OR, they need to schedule it and trying to put people through.
Yeah.
Um, the caveat is there could be people that they call it emergency
Yeah.
C-sections where the baby needs to come out now.
Yeah.
They would take precedence
Yeah. It
over
would
over
bump the
you,
OR.
bump
Yeah.
you, right?
Hmm.
Um, lastly though, there was one procedure that we got done, the manual.
Yes.
Do you mind touching on that?
Yeah. And I feel like, in looking at our timing, we may talk about it in the birth part
The
of
birth,
it
yeah,
too.
yeah.
But when we were near the end, there's a procedure that they do where the physician, specifically the OBGYN, who is a specialist, will manually try to turn the baby. And we did this, I believe, at the 36 or 37-week mark.
Yeah, I want to say 36.
And there's no right or wrong really when it comes to this, right? Because if they had done this too early, the risk is that it stresses the baby out and the baby could be born, right?
Yeah,
Because
it could
now
trigger
you
your body into
Yes,
contractions.
exactly. And the risk of doing it later is the baby's too grown now and there's less and less room for this baby to actually turn.
Yeah,
So I think it was the
yeah.
37, I think 36-week point that we had to go into the hospital basically for the whole day
Hmm.
and have this. procedure done.
Yeah, so they're continuously monitoring the baby, the heart rate, monitoring your heart rate, blood pressure, all
Yeah,
that stuff,
yeah,
and it's called an ECV.
yeah.
And the doctor, witnessed, and it's not comfortable, right? Try to imagine someone pushing on your stomach, like
Without the baby,
without the
and I've
baby,
tried. There's a baby in
and
there,
the
and
doctor, they use ultrasound, but they know by feel, they're professionals, they're experienced that where the head and the bum are, and our doctor that day, he specialized in the ECVs, and he was actually trying to like push
mhm,
manually from the outside, like right on Rapali's skin
mhm,
with some gel and trying to manipulate that baby into
mhm,
rotating head down.
mhm.
Um, Again, we'll talk about the breech birth on our birthing episode. But long story short, it was found that our son had kind of really nestled into the placenta, which it's on the top part of the abdomen, and that was really cushioning him, and he wasn't moving. The doc said,
He was
but
not budging.
yeah, he tried, and
Yeah, I remember asking, "Hey, will you what if we just wait a couple of days and you try this again?" And the doc was like, "No,
no,
he's not
he's
budging." And
not
I was
moving.
like, "No."
Yeah,
And it was extremely uncomfortable. Not only that, though, right afterwards, it took like 3, 4 hours for us to actually get discharged
hmm
because after the procedure, my body and my uterus was in stress. So I was a little bit mimicking contractions. So there was a risk there that I may have to go to the OR and have this baby delivered now.
yeah, no,
But that didn't happen, thankfully.
yeah,
We just, after a couple of hours, they monitored me and they said, okay, you can go home. Your
yeah,
body's back to the natural state. We didn't induce labor.
yeah, exactly. So as you guys can, see and hear, our both of our children's pregnancies, they weren't necessarily easy. There was, a certain level of complication in both. Our children are thriving and doing great, and Holly, is doing great as well. Like, and she was a champion through both those, and she's someone that that I trust to let me know if she's feeling a certain way
Mhm.
or something wasn't right, and I was just there to support her. In our future episode, we're going to talk about the breach. We're going
Yeah,
to talk about how your fitness played into these pregnancies,
yeah,
and I think really optimized the outcomes
yeah.
and successful pregnancies and kind of on time-ish, like
Hmm.
in the between that 37 and
Totally.
40 week. We weren't,
Yeah,
oh my goodness, the baby hasn't come yet. Like
yeah.
it's time.
Both babies were before the 40-week
Yeah,
point,
yeah,
naturally. My water broke.
exactly. Yeah,
Yeah.
37, and then I think
39.
our son was 39.
Yeah, I think
Yeah,
so. Yeah.
yeah. Awesome. Well, I hope you guys love this episode on the pregnancy. And again, if there's more information that you would like, please let us know. You can reach us on Gmail at parentsanonymouspodcast@gmail.com, on Instagram at Parents Anonymous Podcast, and same as YouTube as well.
Yeah. And as we go on, there is other things to talk about. But really, in this, we wanted to wrap up, about the pregnancy itself, the 3 different trimesters, the different symptoms, and sometimes complications that come in each trimester. So hopefully, you guys enjoyed.
Yeah. And we might, touch on some of these again in some other episodes, and
Yeah,
we'll mention the trimesters and what those look like and the different scenarios that we'll talk about.
yeah.
Yeah.
So that wraps it up, and we will see you guys at the next one.
Yeah.
Bye.
Bye.